Welcome back to AM Northwest. You know, looking younger has never been easier. And here to tell us about a popular non-invasive facelift treatment, we welcome from Reviance Plastic Surgery and Aesthetic Centers, board-certified facial plastic surgeon, Dr. James Chan, and his patient care coordinator, Yvonne Troutman. Good to have you both back on the show. Let's talk about, though, why you see, maybe Yvonne, tell me why you see women who come in to get this done. What are some of the reasons they're coming in and the experiences they're having?
The catalyst for most gals to come in to have a procedure done, it typically is always emotionally based. Some of our patients have seen a picture coming back from a family vacation. It could be...
And then they didn't like it. They didn't like what they saw.
Didn't like what they saw. Having to wear turtlenecks or camouflage in the summertime, in 80-degree weather, gals walking around with a turtleneck on. So bottom line, the decision to have a procedure done is typically always emotionally based, usually centering around self-confidence, sometimes self-esteem, and the transformation from before procedure to after is truly phenomenal.
I'm guessing they're thinking, I should have done this before.
Every patient says that. Why did I wait so long? Women have a hard time giving themselves permission to do something just for themselves, especially something that costs money.
Yeah.
So finally, when they take that step, and then the results, very common, I should have done this years ago.
Doctor, I would assume too that for a lot of women, for every woman, there's a lot of options, I should say, for how to fix what it is that they don't like, what they see in that picture, the different procedures available.
Yeah, so what we do and what we're talking about today is the Reviance lift. And what makes it different from a traditional full facelift is that in a traditional full facelift, we're targeting the forehead, the eyes, the cheek, and the lower face and neck. With the Reviance lift, what we're targeting is really the jowls and the neck. And in fact, a lot of people, when they come in to see me, they put their fingers behind their ears here and they pull up like this and they say,
we're looking at
Doctor.
it before and after here, one angle of one woman. Yeah, that looks great. And here again, the same woman. Wow.
How long does a procedure like that take?
The procedure itself takes about 2 hours, and compared to a traditional facelift, it's about half the time of a traditional facelift. And the recovery is a lot shorter, and as you can see, the results are a lot more natural looking.
And let's take a look at another before and after, which is incredible. So it looks like you customize the lift for each person.
Absolutely. We customize it based on their anatomy and what their desires are. And you know, some people have less in the neck and some people have more, but in general, we customize it exactly to what they would like.
And what about downtime?
Downtime is generally about a week, sometimes a little over a week.
Catch up on all your shows.
Yeah, that would be great.
I imagine you've heard some pretty funny responses from the women who come in.
One of the funniest was the gal came, plopped herself down at my desk and said, "My husband just bought a tractor, I'm buying a facelift."
I don't blame her. Yeah.
Like, let's go.
That's
We just
funny.
want to empower women to do something for themselves. And we are so happy to be a part of the process. And it truly is inspiring for us to do what we do. And it makes my job easy working for a man like Dr. Chan, who's just an expert in his field. And I'm just so proud to be a part of it.
Very good.
Well, if you'd like to find out more information, we'll have the information for you on Reviance. I know there's also financing available. You can find out more by calling 503-388-4280. We'll put information for you on K2.com. Thank you both.
Thanks, guys, for coming in. We
Thanks.
appreciate it.
Thanks so
We're
much.
back with more AM Northwest right after this.